Good morning. This is Dr. Latoya Wells, Doctor of Nursing Practice, nurse practitioner, and owner of Wells Legacy Health and Wellness. I was told that you guys are having a talk today, barbershop talk, and that women are not allowed. So I'm just going to be here for a minute to intrude on your gathering. I want to talk a few minutes about mental health and what that looks like in the men that I see in my practice. Mental health is something that impacts everyone. And there are some statistics that show that more than 6 million men experience depression each year. And men are significantly less likely than women to seek mental health. And so what does that tell me? That tells us that many men are struggling in silence when it comes to their mental health. They're dealing with depression, they're dealing with anxiety, many are dealing with suicidal issues, many are dealing with stress and just the burden and the weight of having to carry all the things, working, their families, their community, all the things. And so it's important that as men, you see your mental health just as you see your physical health. That's another topic. I'm not going to go down that rabbit hole, but I want you to know that there is help. And some of the things that we as healthcare providers look for and look at when we're speaking to and we're talking to our male patients is we look at the whole. Well, I'm going to say me. I look at that whole person because you can be healthy physically, you can be healthy financially, you can be healthy spiritually, but yet you can be so unhealthy when it comes to your mental health. And for some men, they don't want to talk about it. And just some of the things that I've heard when I've talked to men is that we've been told that we need to suck it up and struggle through it and push through it. And we can't show our emotions, and showing, emotional things is a sign of immaturity or that I'm weak. And that is so far from the truth. Showing up and reaching out for help is where strength is. And so I just want to talk about a few things today. So one of the things that I want you guys to understand is that anxiety and depression show up completely different in men for some reason. We don't know. It shows up as irritability. It shows up as you withdrawing from your family and your friends. It shows up from changes in your sleep and your mood. It shows up in increased alcohol and substance abuse. It shows up with feeling hopeless and feeling like you are no value to your family. It shows up in difficulty concentrating. It shows up in, you throwing yourself into work, but yet your work is declining. There's so many different ways that depression and anxiety show up. And one of the things that I want you to know is that anytime you're experiencing something outside of your norm, and if there's a mental health component there, many times it may exhibit or show up within your body. So anxiety may feel like you can't breathe. Anxiety may feel like something's sitting on your chest. Anxiety may feel like you're having chest pain and you're about to have a heart attack. That can be anxiety, but we want to rule it out to make sure that it's not a heart attack and that it is anxiety. But I just want you to know that seeking help does not equal weakness. Seeking help equals strength. And one of the things that I want you to know that stress feels overwhelming. Anxiety is difficult and it's affecting your everyday life. You feel depressed more than 2 weeks. So if in the last 2 weeks, if you felt down, hopeless, or depressed, or felt like you'd be better off harming yourself and not being here, then that's a sign of depression. Using alcohol or substance abuse to kind of cope with your feelings. Sleeping more than you usually would, things that you normally enjoyed, you don't enjoy those things anymore, and feeling hopeless, isolated, and emotionally disconnected. If you are experiencing any of those, it's time to reach out for help. There's a lot of local resources that are available to you. 988 is a national suicide and mental health hotline. So if you're ever in a situation where you are just feeling like you need help and you don't know where to turn, you can definitely turn there. For those of you who are connected to ministry and churches, I know for a fact that you can reach out to your leaders and someone can help you, guide you, and direct you in the way to get that help that you need. But most of all, what I want you to know is that strong men seek for help. Strong men reach out to their community. Strong men prioritize their mental health. I can remember someone saying to me, when you hurt your shoulder, you went and you got help for that, right? But you're having some issues with your mental health, and you won't get your mental health is just as important as your physical health, man. So today, as you begin to talk amongst each other, I just want you to know that as women, we need you here. As women, we need you whole 100%. And we need you to show up emotionally and mentally in relationships and for our community. And unless you are whole in that area, you can't truly show up. So, men, it's time to come from behind the mask. It's time to let down the guards, and it's time to talk about what really matters. And that's making sure that you are here, whole, and healthy. This has been Dr. Latoya Wells. Thank you so much for allowing me to intrude on your talk today. If anybody is looking for primary care or mental health services, you can definitely reach out to me at Wells Legacy Health and Wellness, 321-306-6755. Take care, stay safe, and be well. We need you here, whole and healthy. Bye.